So now for the medication administration, intermediate infusion. Let's go back to the med room. Okay, so we need to prepare the correct medication and the dose, check the expiration date here, the vehicle solution type, dilution volume, and max concentration. We also, with this medication, need to label the bag with our patient's name, their MR number, the drug name and dose, the vehicle solution type and volume, and then also the date and time of the administration of this medication, along with you as the RN's initials. And then before going into our patient's room, we need to know the action and purpose of the drug, the safe dose range, clinical implications, obviously our 5 rights, the dilution, solution type, and volume, and then our safe infusion time and rate. And so we are going to be hooking this guy up to the primary infusion that we already have running, and we are going to be back priming it. And then we're also going to bring in this 3 to 5 cc syringe with 3 ml of sterile saline to flush the saline lock before we hook up the IV. So let's open up So we already have one of these guys hanging over in our patient's room, but this is to help hang the primary lower than the secondary. So we want our roller clamp 2 to 5 centimeters underneath the drip chamber, and we'll lock it there. Uncap that guy. And then take the spike off, not touching the edges. Alrighty, now we can go into our patient's room. So let's go over here. And before I even hang the bag, I'm going to say, hi, I'm Sam. I'm going to be your nurse today. Can I have your first and last name?
John Dis.
Okay, Mr. Dis, and what's your birthday, please?
April 15th, 1985.
Great, and then do you have any drug allergies?
I don't think so.
Okay, thank you very much. So let's head over to the pump, and we are going to find our port here, swab for 15, 20. Okay. And we're going to make sure that this guy's clamped down here, the primary, which it is. Okay, so now we're going to hang this guy lower, and we're going to release the roller clamp, and we want to fill our drip chamber halfway. Perfect. So now we'll lock it back, we'll hang it, and now we can unclamp it. Okay, because this guy down here is still clamped. Now let's program it into our machine here. So on, off. Okay, so that guy is on. Let's silence this guy first. And then just to make sure that our saline lock is patent, we want to flush that guy again. Using the push pause. So we're scrubbing here for 15 to 20. We're gonna insert, unclamp, And before we did this, of course, we checked the site for infiltration and phlebitis. Everything looked good. Push pause, no resistance is being felt. Clamp. And put this in the proper receptacle. Okay, so now back to our pump. Here, if you can see, we're going to press Piggy Back. So we're going to press Piggy Back there. Before we do that, we'll hook this guy up. Again, scrubbing. Unlocking. Good. So, back to the pump. Piggyback. So, let's run 200 mLs per hour, volume of 50 mLs. So that's going to be ran over 15 minutes. We're going to make sure that this guy's unclamped. Same with that. And we're going to press start. So time remaining, 15 minutes. We'll see here, once it starts going, it's going to drip. Perfect. And so at this point, of course, we're going to document, but I'm going to show you guys real quick, once again, how to inject into the first port. Okay. So, like we demonstrated before, we need to make sure that the meds and the solution are compatible. If they were not, we would flush the line with saline, turning off the primary IV infusion during the medication, and then flushing after again with saline. And then after that, restarting the primary. So these meds are compatible. And we're going to clamp here. Ensure that this is unlocked. And push pause. Locking. Then taking that guy off. Letting it go. And then we're going to document.